Welcome to ACTPod, a podcast show that sheds light on the stories and impact of the social sector. The show is proudly powered by Aspire Coronation Trust Foundation. Let's begin the change.
Hello there. You're welcome to yet another insightful edition of our podcast, ACTPod, our story, our continent. I am Abiodun Owu and I'm going to be your host on today's edition. So today we're going to be talking to not just one, but two cancer care champions who are right here in the studio. I have with me Dr. Omolola Salako, who is the founder of Sebeccly Cancer Care. It's a non-profit organization into cancer care prevention and all of that. You get to hear from that. They're based here in Lagos. And I also have with me Gloria Okwu, who is the program coordinator of Project Pink Blue, also a cancer care non-profit here in Nigeria. Dr. Salako and Gloria, you are welcome.
Hi, thank you for inviting us.
Thank
you very much, Abiodun.
So, our routine. We'll start with getting to know our guests and, what have you been doing in this space. So please, I guess we'll start with Dr. Salako. Tell us about yourself and your work in the cancer space.
Okay, so I'm a clinical oncologist. I'm trained to treat cancer patients, but I thrive when it comes to increasing access to cancer care. And so you'll find me wearing many hats, leading the cancer NGO, finding apps, and, just generally making, a bad space a bearable place for cancer patients.
Okay, that was quite brief. Gloria, please tell us about yourself.
Okay,
in cancer space.
Yes, program coordinator for Project Pink Blue. I basically am a career program manager. I'm also a breast cancer survivor. So as Project Pink Blue, I not only function as a staff, I also function as a patient advocate, which is born from a result of having survived cancer, living with cancer. I think that's a better way to say it. So it has brought out this passion for me that linked me to Project Pink Blue as a platform in the first place. And at Project Pink Blue, we do things like awareness creation, we do free screenings, we do training for oncology professionals, we navigate patients, and we do research, yes, and fundraising for patients as well. We also offer psychosocial support. That's like one of our core programs at Project Pink Blue. And very importantly, because we put patients at the center, we try to raise patient advocates to advocate for effective cancer care. We believe it's personal for them, and they will do better by being at the forefront. And I think that's why they employed me.
It's really awesome to note that. So you're not just so Project Pink Blue, being a program coordinator at Project Pink Blue, is not just for you a 9 to 5. It's not just a job that you go to. It's something you do as a passion as well, being a survivor of breast cancer, and we'll come to that later. Gloria has talked about the strategies they use at Project Pink Blue. The research, you talked about training, you talked about cancer awareness, and things like that. At Sebeccly Cancer Care, what are the strategies that you use in cancer care prevention as well?
Okay, so Sebeccly is 17 years old, and over the years we've evolved. Yeah, so we've evolved. The first thing I would say is we inspire action, and you'll find us attempting Guinness World Records. In 2015, we gathered more than 8,000 people to stand shoulder to shoulder for about 5 minutes, and we formed the largest human awareness ribbon. The second thing will be we illuminate the dark spaces that cancer causes. We sort of remove the fear. For many of us that are not, that have not been affected by cancer, we have an average risk. So you'll find us, conducting community outreaches, cancer prevention programs, for which ACT Foundation has funded us for the past 6 years. And we've screened more than 30,000 women free of charge for breast and cervical cancer. So you'll find us removing that fear, illuminating the ecosystem, saying that 40% of cancers are preventable, and this is how to prevent it, and these are the screening services that are available. For our cancer patients, because I'm an oncologist, I treat cancer patients every day. It is the most scary thing, one of the toughest battles anyone would deal with if they're diagnosed with cancer. And so just providing a place of hope, providing the right information, giving people, not just the patients, but their family, their loved ones, the right information and tools to make the right decisions. Because the problem we have in many low middle income countries is the fact that when they're making their decisions, it's either based on fear, misinformation, lack of money, cultural or religious barriers. So you'll find us illuminating the spaces with the right information, the right motivation, the right tools. And then I would say we're very, very big on innovation. And that's why we have the first cancer app in Nigeria called Oncopadi. We've conducted more than 4,000 consultations online. So whilst I'm an oncologist and I take great pride in it because there are just 85 of us, I'm also of the opinion that an oncologist should not just serve one hospital. Because we're 85 oncologists in the country and at least 125,000 new cancer cases per year. It just tells you that the country is not covered by oncologists, and the way we can bridge that gap, close that cancer care gap, is by using technology. So when it comes to our third pillar, which is around innovation, you'll find us coming up with the most innovative programs. If we're not screening 30,000 women, we're attempting a Guinness World Record so that 8,000 Nigerians can have fun, and while having fun, they are also learning how to deal with cancer patients, how to know the resources available in their communities. And I would say our last pillar is really around research. And this is important because when you look at how cancer patients respond to care, it is quite different to the Europeans, the Asians, especially that African women have denser breasts. All the more reason they have to start screening early, and they maybe would have to use other screening modalities than other races. It's also important that if we want to understand why Nigerian cancer patients react or respond to certain things around cancer, we have to know the why. And the most the logical and the methodological way of understanding these issues is conducting research. The other advantage of research is when you do have good research, then you attract grants globally from local organizations, scientific organizations, and global organizations. So I would say those are 4 strategies.
And I really hear you on research, because really, if you're going to be doing this right, then you need evidence.
Correct.
And of course, it's research that can produce that. Okay, so I'll go on to Gloria. So Dr. Salako has mentioned, in a way, some of the impact we've had on people. It's great to talk about numbers. It's really, really understandable that we need to reach a lot of people so that they start with awareness, they are informed, and then even if they happen to be screened and they see that they have cancer or in a particular stage, then they can get attention, the treatment that they need and how to navigate through all of that. Could you share perhaps 1 or 2 success stories from what Project Pink Blue has been doing with the beneficiaries in terms of cancer care?
Okay, I think our biggest success story, it's going to be our psychological support center.
Okay.
So over the years, noticed that a lot of treatment for cancer goes into the physical. You take drugs, you take chemo, you do therapies and tests and all. But when a cancer patient is diagnosed, most times what they think is not even the drug immediately. They think of their family. They think of what they are going to lose. They think of their dreams that is going to die. They think of death generally. So immediately, I'm speaking as a patient that I've interacted with hundreds of patients too. So they don't think of the drug immediately or the money. I think the first thing a cancer patient starts thinking is, I'm going to die. What happens to my family? What happens to my parents? What happens to this? What happens to that? And that is where that's where the mental health challenges start from, at the point of receiving that bad news. So people have this, cancer patients carry this mental health baggage. The challenges is enormous. And it's something you live with. So there are days that are good days for you and you're able to say, oh, I'm living for today, I'm fine. And there are days that are bad days that run into weeks, into months, depression, anxiety, and all sorts. So we've noticed this, that the Nigerian health system is not really addressing that aspect of cancer care, and it has a very big impact on the final outcome for a cancer patient. If you lose hope along the way, the drugs will stop working automatically.
Right.
So we started to, we did a little research. We noticed that just about 2% of cancer patients, as at 2021, when we started the psychological support center, just about 2% has accessed any form of psychological, any kind of mental health support. And there's no MDT, where you have a full team and have a clinical psychologist in the team that can talk to these patients when they need to.
What's MDT? Sorry to cut you there.
Multidisciplinary team.
Okay.
Yeah, so this team is supposed to have a clinical oncologist, a nurse, an oncology pharmacist, a psychologist, a full team to manage every aspect of cancer care. Yes, so when we noticed that gap and what it was doing to patients, we decided to set up the psychological support center, and we called out to people to support in any way they can. And so what this center does is to reach out to cancer patients. We might not have money to give them in that center, but we have group therapies, which we usually do once every month. So cancer patients will come together. A clinical psychologist will talk to them on very important topics that people don't want to talk about. For example, divorce and cancer. There's an increasing rate of divorce among cancer patients. People are not talking about it. We talk about death. We talk about issues that you don't want to talk about, but because you're talking with people that understand, you feel they understand what you're going through. You're comfortable to say how you feel about things, and we cry together if we want to cry. At the end of the day, people they feel better, they feel relief, they make new friends among the cancer community. Then they have more time to talk to the oncologist. We invite an oncologist whenever we have these meetings. So at the clinic, it's very short time. But at this gathering now, have an oncologist, and you're free to ask as much questions as you want to ask. So it's a free space for cancer patients and a lot of peer support. And we see the impact it's making. People call us to ask us when is the next meeting coming up. They look forward to it. And then the second one, yes. And second one, all our programs are competing. This is the first. I would say upgrade oncology. Yes, is the next one. And upgrade oncology, we train different cancer professionals every year. And Art Foundation has been funding that for the third year in a row. And why we felt it was important to start training professionals, that we are also looking for sustainable programs that would impact cancer care in the short run and in the long run. And we noticed that, yes, we call people out on World Cancer Day and bring October to come and do screenings. And people always ask us, so what if I have cancer, what next? They always ask that question. If I have cancer, what next? And the what next is they're going to a doctor. And how informed is this doctor? How prepared is this doctor for them? So we train professionals so that they can, offer accessible, affordable, and efficient health care. So
that is awesome.
Yes. So and Art Foundation has been funding that, and it's been wonderful. Every year we have a specific set of professionals we want to train. And then we also offer trainings to all that, like for doctors and nurses, it's a given. Every year they are trained. And then we've extended that to also include other healthcare professionals from the primary healthcare center, which is usually the first port of call for a lot of people that go to report cancer, to secondary and tertiary. We bring them together, we do these trainings, we have panel discussions, and then we see how we can increase. And we do this in partnership with Fulbright Specialist Program in the US. We bring Fulbright scholars in that particular field to come and train people in Nigeria. And the reason is clear. They have a more advanced healthcare system in the US.
Than they do here.
Yes, and these doctors and nurses might not be able to move all the way, the expense and all. So we bring these people to them to come here and update their knowledge for the betterment of the patients.
Even with the fact that Dr. Salako mentioned something scary earlier, or that we have just 85 oncologists in the whole of Nigeria, and we have hundreds of thousands of people coming down with cancer.
Every year,
there probably will be more, with our environments and all of such sorts. So it's a great thing to know that yes, now you are even training more people who can stand up and probably fill the gap that we definitely have at the moment. Dr. Salako, I'll come to you with Sebeccly Cancer Care. Would you like to share a success story or two with us?
Okay, there are quite a number. But I think I'll talk about the SOA Champions, which is an ongoing support group. Okay. So I must mention, 20 years ago, I did lose my sister to cancer. And as her only blood sister, it took a toll on myself because I had to care for her while she was ill. And then when she passed on, which was within 3 months of her diagnosis, then I had to take care of other family members. So really, I didn't have my own space to heal because I had to be strong for my parents and then other siblings. And so since then, I've spent quite all of my working life dedicated to cancer. And I know I'll retire there.
Okay.
So I would say, I would say the one that, I'm really proud of is the story, the Beauty for Ashes story. I would do anything to have my sister by my side. But in her death, we've created this organization that has impacted millions of Nigerians. So am I fulfilled? Yes, I am, because Sebeccly exists. I look forward to stepping down. I've been the founding CEO for the last 17 years. And we've already implemented my execution strategy to step down within 2 years. Not because I'm tired of it, but because, again, we're an innovative organization. We've spun off 2 fantastic startups that I have to go and support, while Sebeccly remains the mothership of all the organizations. So I would say the success story that I'm really proud of is I converted that pain to something very beautiful. And randomly, I'll see a woman in the market. I should say, Dr. Salako, you screened me in this community. And I'm like, me? Okay. And then they're giving me bread or fish or whatever they're selling. And to me, that's what life is about, waking up and getting these heartfelt thank yous that money cannot buy. And I think some of us are wired that way. So for those who are wired that way, they deeply understand what I'm saying. But more importantly, the fact that Sebeccly has contributed to helping other people find their purpose. Because again, cancer steals peace, money, happiness, disintegrates families. So when we are there in that stopgap, saying, hey, guy, your wife has breast cancer doesn't mean you should abandon her. This is how to take care of her. Or, Mom, we know you have stage 4 breast cancer, and when you pass on, you're going to be worried about your kids. We'll look out for them. Or, we're just helping women prevent cancer. Cervical cancer is the second most common cancer in the country. And it is preventable if you go for your pap smear or any of your cervical cancer screening. And here we are able to screen more than 30,000 women. We are able to prevent them from developing these cancers. Because when we screen and we identify the precancerous lesions, we're able to treat. So I would just say I don't reflect on my own story most times because I just feel like, yeah, I'm doing it. There's that empty vacuum my sister's death created. And I have filled it up with all this work, Sebeccly and everything. So I think the most successful story for me is that I used that terrible story, that terrible incident, converted it to passion. And sometimes people will say passion will not get you far. I beg to disagree.
Okay.
It has gotten me this far, not just on local stages, but also my work is recognized globally. But most importantly, I go to bed every night feeling really fulfilled that not just me, but the people who have gone through Sebeccly, team members, volunteers, patients, feel that we have contributed to their lives on a daily basis in a very positive way.
Thank you so much for that. Thank you so much for that. And so let's take a look at our environment, on this part of the world where we're not... I'd say as advanced as we'd like to be. So in terms of cancer care, what are some of the constraints that you're faced with in your interventions, and how have you been able to deal with that? We'll start with Gloria.
Okay. There's a lot of problem.
If you could tell us one.
Okay. The first one is the quality of care. I'm tempted to say money, but no, I think it's the quality of care that is the first problem we have here. And that is what we are trying to do. That's why we're advocating that the government should just stop the brain drain at all costs. Because if cancer patients are going to survive, somebody is going to treat them. And the workload on the doctors is just too much for them. 85 doctors to 125,000 new cases. So there are old cases that they still have to manage with the new cases. So it's a whole lot for them. And this quality of care, also boils down to the kind of drugs, the availability of the drugs. So, the health infrastructure, radiotherapy machines, brachytherapy machines, all the machines you need, the drugs, what is the quality, how are you able to get these drugs? How are you able to administer them? Who's administering them? How well are they trained? You understand? So when you go to the clinic, I speak as a patient now, a whole lot is wrong with the system. The system is falling apart, and the cancer patient is at the center, just, hoping for a miracle. There's so much misinformation. There's so much you don't know, even from your doctor. You have to ask questions, and then you see people come to the support group to ask questions like, what are your side effects? Now, that is dangerous because everybody reacts to every medication differently. But because you don't get enough information from your health practitioner, because the health practitioner has very little time to interact with you because of so many people waiting outside, you resort to asking questions from people you should not ask, from other survivors, and that might not impact well on the treatment. So the quality of care is a very, very big problem. And then money is another very big challenge. Every month at Project Pink Blue, we get over 150 calls to 200 calls, people asking for money to access treatment.
Understandably so, because you're not for profit. So
yes,
all that you're doing is, in fact, free services that you provide.
Honestly, so to
cancer patients.
Yes, they're asking for money. Of course, some will call you and tell you, I have money. I just want to know if I'm going to be fine. So this once the job is cut out, it's psychological support they need. But most of the patients are calling. They're asking for money. They're asking for to navigate them to where they will get treatment, radiotherapy, which one is working. Sometimes you navigate them, and when they get it, the machine is not working. And they call you again, this machine is not working. Why did you bring me? I say, I'm sorry, it was working as at last week when I checked.
And then this comes back to quality of care.
So I think that is the biggest problem. Money is a very, very big challenge. Many people have died because they can't afford drugs. But the quality, even those that have the money, will rather be treated outside the shores of this country.
If they can afford
if
it.
they can afford it. So the quality is the biggest problem we have.
Dr. Salako, I'd like you to chime in here. She has talked about quality of care, of course, the issue of funds. Is there any other constraints that in Sebeccly cancer care you are experiencing in terms of cancer care as well?
Well, I would say it will be funding for us at Sebeccly.
Okay.
And that's because cancer care itself is very expensive. A patient needs to spend between 1.5 million and 10 million naira in a year to get quality care. I do agree that there are barriers when it comes to quality of care, but we must also pat ourselves on the back here in Nigeria that quality of care has improved because we do have more radiotherapy centers. Is it enough? Of course not. But from where we are coming from, well, snail speed, there's some improvement. A lot of patients are not traveling to India and Ghana and paying $50,000 for whatever treatment they're receiving abroad. Care is now available in country. Of course, there are some states that do not even have an oncologist, talk less of a radiotherapy center. But for the centers that we have 10 centers of excellence when it comes to oncology care in country. Now, a lot of cancer patients are not able to cough up ₦1 million for radiotherapy or 400,000 naira for chemo. So you will find a lot of patients present to the hospital they will get an invoice, but they will never come back. And in some hospitals, these invoices are to a tune of about 3 billion naira. So where are those patients going to? A lot of advocacy is going on around universal health coverage, that more cancer patients should be insured. And okay, so less than 5% of Nigerians have health insurance. For the 5% that have health insurance, most of them are not covered, for cancer care. So many patients are spending out of pocket. So just like she said, a lot of calls, our support group meetings are riddled with we may be talking about nutrition for this month's support group meeting, but when we are rounding up, taking questions, the questions of where do I get funding from? I need chemotherapy. I've started 3 courses. I need 2 more courses. I need 300,000 naira. And so some of the solutions we've deployed, crowd fundraising, like 1K for cancer, donate 1,000 naira. And we launched this as far back as 2012. It was launched by Wana Odo Bank in partnership with Sebeccly. And every year we launch that program. If everyone can donate 1,000 naira, we would then, pull the money at the end of the campaign and support a certain number of patients. In good times, we've raised as much as 15 million. In bad times, we've raised maybe 200,000 naira. Okay. And the resources, so the demand always outweighs the resources. So even if you have 1 billion naira,
it's still never enough.
It's never enough, and that's why one of the things we are doing at Sebeccly is we've spun off our own cancer clinic where we're able to treat our cancer patients, and we are developing this new model that we're hopeful that it would work. So on Fridays, we call it the Thank God It's Friday Breast Clinic. Okay. We're starting with breast cancer patients, and we launched it last year. A breast cancer patient on an average needs about 5 million naira for her care. We're going to split that cost between 3 parties. Sebeccly will raise some funds, 25%. The sister organization, our cancer clinic, which is called Pearl Oncology, will provide a discount to that treatment by 25% as its CSR. And the patient will pay 50%.
That's something.
Yeah. So far, we've enrolled about 40 patients, and we're watching how it will work. And so, because we have our cancer clinic, our cancer hospital, we can reduce our profit margins for a certain number of patients. As it is, we've supported about 30-something patients, but we do have about 100 and something that have applied. And so we have to bring in measures of identifying who really needs it. Because again, when you're helping some patients, some will abuse it, some can afford it.
So you need to prioritize. Yeah. Okay, awesome. Talk about, innovative ways of, finding ways around funding, because I hear you. Funding has always been a constraint, a challenge for non-profits, and we keep finding creative and innovative ways to get this funding. So as we round up, so if a donor or a partner was to, to find you, where would they find you? Perhaps you want to tell us your social media handles. How can donors find you? Gloria.
Okay. So we have a website, www.projectpinkblue.org. That's our website. And we're on Twitter as Project Pink Blue, Facebook as Project Pink Blue. In fact, all social media handles as Project Pink Blue, you will find us there. Or you can come to our office. We have our physical office at Utako in Abuja, number 11 Moses Majekodumi Crescent, Utako. That's our physical office. So if you come there, you see us.
All right, Dr. Salako?
So for us at Sebeccly, again, we're very active on Instagram, Facebook, and LinkedIn. So you'll find us on Sebeccly Cancer Care, SEBECCLY. And I'm very active on LinkedIn and Instagram. You'll find me as Dr. Omolola Salako, the People's Oncologist.
Okay, so finally, in 1 minute each, what can you tell us about your partnership with ACT Foundation? How's the journey been? Dr. Salako?
Well, I'll first of all say a big thank you to ACT Foundation, because it's very rare for any donor organization to support an NGO for 6 long years. And I say it anywhere I go. I'm very proud of our milestones. We've screened 30,000 women free of charge for cervical cancer, and we've provided treatment for these women. And it's all because right from inception of ACT Foundation set up our time to screen unit, provided us with consumables to screen all of these 30,000 women, provided us with funds to purchase the equipment that we use to treat these women. It's the first for us in Sebeccly, and we are very, very grateful for all the work we have done. And all the women we have screened say 30,000 thank yous for bringing good health to their communities.
Thank you. And we're so proud of what Sebeccly Cancer Care is doing in Africa as well. Gloria?
I also want to say a very big thank you to ACT Foundation for the Upgrade Oncology program. It's our hallmark program, and every year we train at least 300 healthcare professionals, virtual and physical. And this is because of the support they've given. I want to thank ACT Foundation for their flexibility, for their understanding, because it's not all the time that the project goes as expected, and then they understand and still try to guide you through another route to achieve what you want to achieve. So we're really thankful, and all the health professionals are making strides. Just recently, for the AACR conference in Florida, our Great Oncology program for 2021, training of oncology pharmacists, they were able to write, they have a paper, and they presented at that conference, who reconstitutes your chemotherapy. It was done in partnership with oncology pharmacists from the 2021 training, just to show you that there's a kind of sustainability. It doesn't just die there. We're trying to see how we can sustain these efforts every year and make sure that whatever we teach at these trainings somehow goes into a curriculum. It's somehow stepped down to other people, and so that it keeps snowballing. So, and all this is, because we are being funded and supported by ACT Foundation, and we say a very big thank you.
Yeah, and we are so proud. I must tell you that we are so proud of what Project Pink Blue is achieving, in Africa and around the world. Okay, thank you so much for listening and viewing today. This is where we call it a wrap. You've heard it all from our cancer care champions. Do join us on another episode of ACTPod. Bye.
Thank you for listening to ACTPod. For inquiries and feedback, please reach us on actpod@actrustfoundation.org. Follow us on social media at ACTFoundation_ on Instagram and Twitter, and Aspire Coronation Trust Foundation on Facebook. The show is proudly powered by Aspire Coronation Trust Foundation. ACTPod, our story, our continent.